extreme.
The most healthcare. So we're trying to direct more of these slots to go to make sure that they are in institutions and hospitals where we haven't always done a good job of meeting the needs of communities there. And there are thousands of these residency slots. They're called graduate medical education, GME slots. Congress gave us money to actually fund an additional 1,000 graduate medical education slots over the next 5 years. And I guarantee you there is a ton of lobbying by everybody wanting those slots. And we're saying, great, show us how we're going to address the disparities that we see in America. Because where you train, and Dr. Wimberly, I don't know where you train, but there's some studies and research that's been done that shows that where you train, you end up living. And so if all the places that already have a lot of doctors are the ones that are going to get you to do their residency there, you're just adding more doctors to a place that already got too many. But if you train up in a community that doesn't have a whole lot of those medical professionals, and you get them there by doing their training, and then all of a sudden they start to develop friendships and they stay. And so we want to direct these graduate medical education slots where we can in a way that meets the needs of America. Other thing we're doing, we put in about $100 million, I think it was last year. Simply, we didn't put a lot of strings on it. We just simply said, stress is really high in the healthcare workforce. People are burning out. We put it out there in different grants, and we said, as long as you can show accountability, we want you to go out there and help keep your healthcare workforce and grow it. So if you want to increase your pay, you want to offer people additional benefits, you want to offer them training, whatever you want to do, just help us keep people from leaving the healthcare sector. We have made $250 million investment in trying to increase the number of workers that will come on board to address areas where we need more health professionals. And so we're going to try to boost the workforce there. We're going to do what we can, but at the end of the day, we don't pull the lever because we don't select the next graduate student who's going to go do a residency, but through our GME program, we can say this is where the slot will be.
Thank you for that, and I'll tell you, as a former leader of graduate medical education, those slots are very much so welcomed and sought after. And at Grady Health System, we actually are one of the largest systems in the country that has those slots with Emory University School of Medicine as well as Morehouse School of Medicine who share that. So definitely appreciate that and very well needed. The stats for the state of Georgia as it relates to that show that there's about a 75% chance that if you train in your residency in Georgia that you will remain. So definitely a testament to what you stated. And then depending on when you look at those in underrepresented and minorities, the rates may even go up to 90 to 95%. So definitely an opportunity from that physician workforce looking at that in primary care, but also, like you said, for health professionals in general. You definitely hit the nail on the head with the retention piece as well, because we can't be a revolving door being able to recruit people who then get burned out and leave. So looking at it from both those programs, from the pathway programs that lead up to that, as well as being able to retain people that we do have in healthcare is key.
And can I mention one other program
Yes.
that I really should have started with, because especially in communities of color, this one's critical. We have a program where if you are willing to commit 5 years of service in an underserved area of the country, we'll pay for your medical education. That is a great deal, and I can tell you personally because my son-in-law went to Mount Sinai Medical School in New York, 4 years, no debt after 4 years. He's now a pediatrician. He finished his residency. He's now working in an underserved community in the Salinas area of California, where he's principally helping a lot of families, many of them migrant families that work the fields in that area. 5 years he's got to commit to provide that service. But he does it with a smile because he was going to probably do that anyhow. So, you know, it's one of those deals where you're going to do it anyhow. May as well get the government to help pay your college, and that way your school of medicine, you don't come out with a ton of debt. We're increasing the number of slots that we have for that program, National Public Health Service. And we want to encourage folks who come from these communities that have been left behind. And I suspect the report that the Urban League issued points to just how disparate the needs are in some of our communities. There are going to be some bright minds that are just trying to figure out, how can I become a doctor? I cannot afford to become a doctor. I can't go to school. I can't pay that. You're probably going to come back and practice where you grew up or somewhere, trying to help folks like your family. Let us pick up your 4 years of medical education, $200,000-$300,000. Just give us the 5 years you're probably going to give anyhow. Help us.
Definitely. We have time for more. One more. Okay, one more. So, the last question that we wanted to bring up is taking it now to the community, okay? We both know that the community is such an important indicator of health. Studies have shown that a person's zip code, you know, really does have a huge effect on their life expectancy. You can see within a 6-mile radius with different zip codes, and sometimes within the same zip code with different neighborhoods, depending on the demographics, that there is a huge variation in life expectancy. So on a community level, when we're talking about really prevention, that you mentioned earlier, talking about prevention is the key. And we talk specifically about access to healthy and nutritious and maybe, you know, exercising, those types of daily activity things that I think oftentimes we take for granted, and how much those are prevention methods towards chronic illness. What are some of your thoughts around some of the advances that we've made in making communities healthier, especially those communities that we know have lower life expectancy rates?
Yeah, and I'm glad that this is the last question, because we're talking far more now at the Department of Health and Human Services about trying to move our healthcare system from a system that cares for illness, an illness care system, to one that promotes wellness, that keeps you healthy from the get-go. And the more we do that, the more we heed my mother and Frederick Douglass' advice of building strong communities. What's interesting is that we not just make America healthier, we make America more prosperous. Because if we're not spending, you know, I mentioned Medicaid, kids may be more than or close to half of all the recipients within the Medicaid program, but they only cost us about 20% of the Medicaid budget. Seniors constitute less than half of the population, but they cost us over 60% of the budget. That's sort of the inverse. And that's because, you know, we get older, sicker, harder to heal. And principally, it's the 5 or 6, 7 major chronic diseases, right? Everybody knows diabetes, hypertension. Those things are costing us a fortune. And I say us out of our own pocket, but us as taxpayers. If we moved into a system of healthcare that was based on wellness, so that we didn't wait till you presented with diabetes, and now we have to treat your diabetes for the rest of your life, but we prevented you from having the conditions that help the onset of diabetes. I should get my mom over here. She would always say it so well, you know. It's like your mom telling you something that you look back and say, well, she was right. I should have done that a long time ago. And so it is moving into a system of wellness care. So at HHS, we treat food as medicine. I go around the country now and I say to folks, I'm looking forward to the day when we have a wellness care system when Dr. Wimberly sees her patient, that minor, and you finish and say, well, Ms. Smith, I got good news, bad news. Good news is your child's pretty healthy. Bad news is she's a little deficient on vitamin D, vitamin C, whatever it is. Here's a prescription. We'll see you in a couple months. Ms. Smith takes that prescription. She takes a look, and she goes to go get it filled. She walks into the grocery store, pulls out some fruits and vegetables. Maybe not the broccoli for some, maybe asparagus, some berries, some nuts. She goes to the counter. She's about to pay, and then she hands over the prescription. The grocer says, I see you got a prescription. That's a 20% discount on those fruits and vegetables and nuts and berries. And so that we all as a team in America, not just the physician, not just the parent, but the grocer, the employer, everybody looks at this and says, it is in my interest to keep all of us healthy. And so you get a 20% discount for buying fruits and vegetables and berries and nuts instead of the packaged stuff. And I know that 20% discount I gave you is going to be way better discount for the United States of America. If we can get to that point where we start talking wellness versus illness, we are going to be a much stronger country. And we're already a pretty strong country. And if we do that, and we do it early, I guarantee you, that little black child, that little Latino child, that child in that family that doesn't have a lot of money, the child that comes from a family that never had access to insurance coverage for health care, the child who's had to move because the economic uncertainty makes it difficult, the child who lives in a home with food insecurity, all those things begin to disappear when we start to treat each other as family. I begin to treat your child as my child. And I say, I want to see you be able to afford those fruits and vegetables. They maybe cost a little bit more than that packaged stuff, but I'm giving you a discount, so you buy that. And that's not medicine directly, but in a wellness care system, that is absolutely medicine. And so, food for thought. Let's get to a wellness care system and avoid an illness care system.
I love that. I wish we could start it tomorrow. Well, I think our time here is winding down, but I would like to just thank you so much for this conversation. I'm sure that I speak for others when I tell you that this has really been a great conversation, fascinating. Thank you for coming down. Thank you to the Urban League for the report on the state of Black Georgia, and I'll hand it back over.
Thank you. Mr. Secretary, Dr. Wimberly, thank you both for such an insightful ideas and partnership and encouragement that lets us know that together we can make a difference in access to health care and health outcomes for Black Georgians and others in our state. With the willpower and support of elected officials, along with business, community, faith-based, and civic leaders, we together can save lives. Once again, on behalf of the Urban League, I extend our gratitude to our partner in this event, Grady Health Systems. Thank you very much. Secretary Javier Becerra, thank you, Mr. Secretary, and all of you, for taking time to join us today to explore solutions to deeply entrenched problems in our healthcare system that must be solved in order to save lives and bring equity into healthcare so that everyone, each and all of us, have access to an opportunity to health care. And to our listening audience out there, to you, Ms. Johnson, I know that you're listening on Zoom. Thank you for coming, and we hope you will stick with us as we continue to elevate the importance of this issue and work together for sustainable change. Mr. Secretary Becerra, has agreed to participate in a receiving line for approximately 15 minutes before he leaves. And I'll turn it over to my colleague to give us further instructions. But before I do that, Mr. Secretary, I don't know if you're aware that the National Urban League is comprised of 93 affiliates. Unbelievable. But I'd be remiss if I didn't acknowledge our associate, our partner, Tracy Mosley, who is the president and CEO of Greater Columbus. Thank you, Tracy. Secretary, I also want to mention to you that without support, we could not have accomplished such a momentous event. So I'd be remiss if I didn't thank our partners, the United Way of Greater Atlanta. Where's Milton Little? Milton, he's gone, but thank you, Milton. Thank you so much for your support. The Community Foundation of Greater Atlanta. Is the Community Foundation here? Well, we thank you very, very much. We thank LIF. Is LIF here also? We thank our friends at LIF. PNC Bank, LISC, and our friends at Georgia Power. We thank you. I see our board member, Larry Hughes, here, also a member of the Urban League of Greater Atlanta Board. Thank you, Larry, for joining us today. And thank you, Ms. Johnson, for her leadership, Mr. Secretary. She is a dynamic leader, and without her leadership, none of this would have been possible. At this point, I'm going to turn it over to my colleague to bring us home.
Thank you, Secretary. Thank you, Dr. Wimberly. We will now move to the photo op session and mingling. There will be a receiving line, and it will be extremely controlled for obvious reasons. As it relates to members of the media, we are going to refrain from Q&A at this time, but there will be opportunity for close-up shots and photo ops. Thank you very much for your time. Have a good day.